Perform hand hygiene outside of the patient room or in the anteroom. Either hand sanitizer or soap and water may be used. Put on your isolation gown. Placing your thumbs through the thumb loops. Tie the gown in the back. Put on gloves. Touching only the straps, remove your used N95 respirator from the bag. Avoid touching the inside of the respirator. Pinch the sides of the respirator together to open the respirator fully. Next, bring the respirator to your face and tuck the bottom under your chin. Wear the top strap high on the back of your head and bottom strap around your neck, under your ears. Use fingers from both hands to press down the metal bar over the bridge of your nose. Perform a seal check by exhaling sharply and feeling for air leakage around the edges of the respirator. If air leaks, adjust and check it again. Follow manufacturer's instructions for performing a seal check. Remove and dispose of your gloves. Perform hand hygiene. Put on eye protection, either a face shield or goggles. Put on new gloves.